Hi, my name's Jess and welcome to the Our Outcomes user guide for staff. What is Our Outcomes? Our Outcomes is a simple and easy to use tools and services to be able to track patient, staff and carer perceptions of health status, well-being, confidence and experience. Our Outcomes is a short generic patient-reported outcomes measure, or PROMs, and there are 4 tools that are used within Our Outcomes. How are you, which measures a health status, how you are feeling physically and mentally, and how much you can do. How are we, which measures patients' perceptions of care and the service that is provided, and this is suitable for all patients and all care settings. Health confidence, which looks at the people's confidence in their knowledge, self-management, access to help and shared decision-making. And personal well-being, which measures people's happiness or subjective well-being. And this is based on the ONS wellbeing measures. We also have a staff and carers survey, and again there are 4 tools that sit within this. There's the staff how are we, which measures the staff perception of the service, including kindness, listening and explaining, and promptness and organisation. Job confidence, which looks at staff's confidence to do their job, including knowledge, self-management and access to help, and involvement in decisions. Work well-being, that looks at staff well-being, including job satisfaction, worthwhileness, happiness and anxiety. And how are they? This is a need and risk assessment for people who are unable to answer the survey questions themselves. So for example, if a patient or service user has high levels of dementia. As part of the staff user guide, if you have any issues, you know that in your first instance, please contact your manager or to contact your local Our Outcomes lead. So what makes Our Outcomes different? The Our Outcomes modules and questionnaires are generic, so that means they apply to all people. They're short, which means they are quick and easy to use, and they are a family of measures, which means that they work all in the same way and can be used collaboratively together. The table behind me will show how Our Outcomes compares to other PROMs measures that you may have used or seen before. What is your role in collecting Our Outcomes data? You have an incredibly critical role. You are the front line who will be asking patients and service users to complete the Our Outcomes feedback questionnaire. You will then be entering the data onto the Our Outcomes server, and this will pull together to support the evaluation of the service that you work for. So you are really critical to the success of the survey and to evaluating your service as a whole. So what will you receive from Our Outcomes? You will receive a questionnaire that you might receive in either a paper copy or as a web link or URL, and you will also receive monthly reports. The reports may include a before and after comparison showing changes following the intervention of the service that you are providing. So, how to ask people to fill in the questionnaire? Firstly, remember to introduce yourself and explain that you would like them to answer a few questions about themselves and what they think of the service that has been provided. Remember to reassure them that this information will only be used to support and improve the care that they have been provided with. Make sure that you explain that everyone is being asked these questions and that answering the questions is fully voluntary and the results will continue to be anonymous. Make sure that you offer them help. Ask if they need help completing the form and provide assistance if they do need it. Just a quick note on timing. We've found that it can be really useful to ask these questions near the start of a face-to-face meeting because the answers are often of clinical value. And remember, with new patients, and for new referrals, the patient experience questions relate to their prior experience of health and care services. Just a few frequently asked questions. So what happens if you don't manage to answer every question? Just don't worry about it. Ask as many questions as possible. If people do not wish to answer some questions, it is okay to leave them blank. When should you ask the questions during your time with a patient? Do what seems most natural. However, we have found that asking Our Outcomes questions at the start of a session can raise issues that may be clinically relevant. What to do if people ask you to explain what a question means. The wording has been designed to be deliberately vague. For example, a little pain can either mean low intensity or some of the time, or it can mean both. There are no right or wrong answers, so try to avoid explaining exactly what the questions are asking. Are the questions different on a patient's first visit? No. Although the main focus of the survey is on the service you are providing, on the first visit, people will only be able to talk about the service they have had previously. How much data should you be collecting? The more data that is collected, the more accurate the picture will be of the service, so the more the merrier. Thank you very much for listening, and if you have any further questions, there's more information on our website.